How to manage and tackle anxiety. A complete guide. Anxiety is a pervasive yet often misunderstood experience affecting millions of people worldwide. While it can be a natural response to stress or danger, chronic anxiety can disrupt daily life and overall well-being. This guide aims to provide a thorough understanding of anxiety, its triggers, and effective strategies to manage and reduce its impact, focusing on moment-to-moment management of anxiety. What is anxiety? Anxiety is a natural response to stress that prepares the body to react to danger. It involves a complex interplay of physical, emotional, and cognitive components. When faced with a perceived threat, the body triggers the fight or flight response, releasing adrenaline and other stress hormones to prepare for action. This response can be beneficial in genuine danger, but in many cases, anxiety arises from perceived threats that are not actually harmful. The biological basis of anxiety. The brain plays a crucial role in the experience of anxiety. The amygdala, a small almond-shaped structure in the brain, is responsible for processing emotions and detecting threats. When the amygdala perceives danger, it sends signals to the hypothalamus, which activates the fight or flight response. This leads to physical symptoms such as increased heart rate, rapid breathing, and muscle tension. The psychological aspect of anxiety. Anxiety is also influenced by psychological factors including thoughts, beliefs, and past experiences. Cognitive theories of anxiety suggest that it often arises from distorted thinking patterns, such as overestimating the likelihood of negative events or catastrophizing outcomes. These thought patterns can create a cycle of anxiety, where the individual becomes increasingly focused on potential threats and less able to assess situations rationally. Common triggers of anxiety can be, well, quite varied. Anxiety can be triggered by a wide range of factors, including genetics, stress, substance use, and medical conditions. Genetics, for instance, play a significant role. A family history of anxiety disorders can increase the likelihood of developing anxiety. Stress is another major factor. High levels of stress from work, relationships, or life changes can trigger anxiety. Substance use, such as overuse of alcohol, caffeine, or drugs, can exacerbate anxiety symptoms. And finally, certain medical conditions like thyroid disorders or heart disease can cause symptoms of anxiety. Trauma, especially past traumatic experiences, can lead to chronic anxiety and post-traumatic stress disorder, or PTSD. Understanding the cycle of anxiety is key to breaking free from its grip. The cycle typically involves four main components. First, there's the trigger, an event or thought that initiates anxiety. Next, the brain interprets the trigger as a perceived threat, thinking it's a potential danger. This leads to the anxiety response, where physical and emotional symptoms of anxiety occur. Finally, there's the compulsions or avoidance phase, where actions are taken to avoid or mitigate the anxiety. These actions provide temporary relief, but, unfortunately, they also reinforce the cycle. Let's consider an example of the anxiety cycle. Imagine you have a fear of public speaking. The trigger might be an upcoming presentation. Your brain perceives this as a threat, leading to anxiety symptoms such as sweating, shaking, and a racing heart. To avoid these uncomfortable feelings, you might decide to skip the presentation or find an excuse to leave early. This avoidance provides temporary relief, but it reinforces the idea that public speaking is dangerous, making you more likely to experience anxiety the next time you face a similar situation. If you are enjoying our video so far, please smash the notification like and subscribe buttons. Effective strategies to manage anxiety. Managing anxiety involves addressing each component of the anxiety cycle. Here are some evidence-based strategies to help you break free from anxiety and regain control over your life. Identify and challenge intrusive thoughts. One of the most effective ways to manage anxiety is to identify and challenge the intrusive thoughts that fuel it. Cognitive behavioral therapy, or CBT techniques, can help you recognize and reframe these thoughts. Recognize false alarms. Many anxiety signals are false alarms, much like a fire alarm that goes off without a fire. Learning to recognize when your brain is sending a false signal is crucial. Ask yourself, is this really a danger? What evidence do I have? How likely is this to happen? Challenge your thoughts. When anxious thoughts arise, question their validity. For example, if you think, I'll make a fool of myself during the presentation, ask yourself, is this thought based on facts or assumptions? What evidence do I have that supports or contradicts this thought? How likely is it that this worst-case scenario will actually happen? By challenging your thoughts, you can reduce the power they have over you and prevent them from escalating your anxiety. Practice controlled breathing. Controlled breathing techniques can help calm your body's physical response to anxiety. Diaphragmatic breathing, also known as belly breathing, is particularly effective. Diaphragmatic breathing. Position your hands. Place one hand on your chest and the other on your lower ribs to help guide your breathing. Inhale slowly. Breathe in deeply through your nose for a count of 3, allowing your belly to rise while keeping your chest relatively still. Exhale slowly. Breathe out slowly through your nose or pursed lips for a count of 3. Repeat. Continue this pattern, focusing on slow, deep breaths. Diaphragmatic breathing helps engage the parasympathetic nervous system, which counteracts the fight or flight response and promotes relaxation. Exposure and response prevention, or ERP, is an evidence-based treatment for anxiety and related disorders. It involves gradually exposing yourself to anxiety-inducing situations and refraining from engaging in avoidance behaviors or compulsions. Steps for ERP. First, identify triggers. Make a list of situations or thoughts that trigger your anxiety. Next, create a hierarchy. Rank these triggers from least to most anxiety-provoking, then engage in gradual exposure. Start with the least anxiety-provoking trigger and gradually expose yourself to it. For example, if you fear public speaking, begin by speaking in front of a small group of friends. Prevent compulsions. During exposure, refrain from engaging in avoidance behaviors or compulsions. For instance, avoid checking your phone or making excuses to leave. Finally, practice regularly. Repeat the exposure until your anxiety decreases, then move on to the next trigger on your list. ERP helps retrain your brain to recognize these situations as non-threatening, reducing anxiety over time. Acceptance and commitment therapy emphasizes accepting anxiety rather than fighting it. By accepting and embracing anxiety, you can reduce its impact on your life. Change your perspective. Most of the time, what you are afraid of never happens. Stop assuming the worst-case scenarios. View anxiety as a normal part of life, not something to be eliminated. Accept anxious feelings and allow them to exist without trying to fix them. For example, when you feel anxious, say to yourself, I feel anxious right now, and that's okay. Develop a new relationship with anxiety. Treat anxiety like a persistent but harmless companion. Instead of fighting it, acknowledge it with acceptance. Welcome to the party, anxiety. You can stay, but I'm not going to react to you. This approach helps reduce the power anxiety has over you. Understanding how thoughts create and amplify anxiety is crucial in managing it effectively. By learning to control your thoughts, you can significantly reduce anxiety. Thought management techniques. This involves identifying and challenging negative thought patterns. Ask yourself if your thoughts are rational or if they are exaggerated. Replace negative thoughts with more balanced ones. Mindfulness of thoughts. Pay attention to your thoughts without judgment. Recognize when your mind starts to wander into anxiety-provoking territories and gently bring it back to the present. Positive affirmations. Use positive affirmations to counter negative thoughts. Repeating statements like I am capable or I am safe can help reframe your mindset. Thought stopping. When you notice an anxious thought, consciously tell yourself to stop. This can interrupt the cycle of negative thinking. Real-life application. Situation. You have a big presentation at work, negative thought. I will mess up and everyone will think I'm incompetent. Challenging thought, I have prepared for this presentation. Even if I make a mistake, it doesn't define my overall competence. Positive affirmation, I am prepared and capable of delivering this presentation. By actively managing your thoughts, you can prevent them from escalating your anxiety and regain control over your emotional state. Remember, the most effective way to deal with anxiety is to not entertain negative and stress-provoking thoughts. Create positive and empowering thoughts. Anxiety is a manageable condition. By understanding its triggers and using practical moment-to-moment strategies, such as challenging intrusive thoughts, practicing controlled breathing, engaging in exposure and response prevention, and managing thoughts, you can significantly reduce its impact on your life. Remember, the goal is not to eliminate anxiety completely, but to change your response to it, enabling you to live a more balanced and fulfilling life. Please smash the notification, like and subscribe buttons. Don't forget to leave a comment. Please visit our fast-growing channel and share us with friends and loved ones. This video was scripted and produced by SHN&x, a high-quality content creator. See you on our